Hello, I'm Douglas Bull. I'm an ophthalmologist at Reedsburg Area Medical Center. Today I'd like to explain to you what cataracts are and how they can be treated. Cataracts are a very common condition that we see in our practice every day. As we age, our natural lens becomes cloudy. That's all a cataract is. So when light enters your eye, it goes first through your cornea, which helps to bend the light rays to the back of your eye. But in addition to this, the light, once it's bent through the cornea, goes through the opening in your iris, which is the pupil. Next, right behind the iris is where your lens resides. The lens also helps to bend the light rays, and then that focuses it onto your retina. Specifically, it goes to your macula, and in the center of your macula is your fovea. That's where most people have their best vision, and we see 20/20 in that area. If there's any obstruction prior to the light entering into those areas, then the vision becomes blurred and cloudy. And so the common symptoms of cataract are difficulty reading, especially in lower light, driving at night when there's less light as well. Other problems can occur that lead to more difficulty in just everyday activities for people. And if cataracts become severe enough, can cause difficulty even with daily activities such as walking downstairs, eating, and other normal things that we do every day. The most common causes of cataracts are aging. For most people over age 60 to 65, about half of people will have already developed a cataract at that age. Other problems can be trauma, injuries to your eye at a younger age, or even when you're older. They can cause specific cataracts. Medications such as steroids, systemic conditions like diabetes can increase your risk for cataract formation as well. So in order to treat these problems and restore your vision, oftentimes your eye care provider will either give you new glasses, and oftentimes that will help to resolve the problem for a specific period of time. But many times people start to develop the need to have significant increase in their prescription. They can require significantly more prescriptions within less than a year's time. When that begins to occur, then it's time to probably consider cataract surgery, which is a very excellent option for improving your lifestyle and also your vision. With cataract surgery, a small incision is made into the eye, which is through the cornea, the front part of your eye. That incision generally is about 2.4 millimeters, and through that incision, we are able to access the front of the natural lens, and the natural lens again is what is cloudy, and that's what the cataract is. So those are just essentially proteins that have become kind of clumped up over time, and they need to be removed. Most of the time, that analogy that I make to patients is that the cataract is kind of like putting tint in your windshield. And so if you put 5% tint in your windshield every year, after 10 years, you've got 50% tint in your windshield. So if you're trying to drive at night, you're not going to be able to see through that. And that's what we like. Pretty much everybody sees that kind of cataract or develops that type of cataract. I would say by the age of 65, people develop this nuclear cataract, which causes this tinting and decrease in ability to see at night. We then need to begin to address that because that becomes difficult, especially if you're in a restaurant or trying to see at night. When you're driving, those are factors that can increase your risk for being unsafe or having accidents or falling downstairs. So those are very valid reasons to remove a cataract. We are always happy to assess that in our office. If these symptoms are something that are bothering you, we are happy to evaluate you, and please contact us at the Department of Ophthalmology at Reedsburg Area Medical Center.